Dr. Lieutenant Colonel Kamal Kalsi, thank you so much for being with us on ITV Gold. How are you doing today?
Awesome, Aditi. Always a pleasure.
Of course, we
How are
have
you?
to, great, staying safe and healthy as much as we can. We have you today because so much is happening in the nation and we want to continue raising awareness about coronavirus pandemics, updates and measures and the impact. To starting off the show, I want to share some stats today that are coming in. We're looking at 28 million cases globally of coronavirus, with 905,000 deaths at least. In the United States, we are looking at 6.4 million cases almost, with at least 191,000 deaths. My first question to you is the pandemic over since people are getting not as serious about it around us?
No, absolutely not. I think all indications are that we are far from this pandemic from being over. The latest data from up in the Northeast where we are
Right.
is that certainly infection rates have slowed, but now they're starting to pick up again, right? So as kids have started going back to school, college kids have started going back to school, restaurants have started opening again, people are visiting the beaches and the shores and public spaces. I think it's inevitable that we will get to a point in another month or two where we're going to have to start to shut down
Wow.
things again.
Oh, so you can expect a shutdown maybe in case we can't control a surge back in the Northeast.
I think nationally, that's what's needed. We definitely need a cohesive national strategy that involves a shutdown and folks wearing masks and hopefully we get a vaccine soon, but it's going to be tough. I know that the recent vaccine that's being created by one of the manufacturers has had some development issues, and they had to stop the trial because there was a pretty serious adverse reaction, adverse event. And I think, I can't speak for the larger public, but my family and I were having a conversation, and it just seems that it's all being sort of rushed, and it does not engender any faith or trust in the vaccine that they're developing.
You just mentioned vaccine, and I have to ask you, this is AstraZeneca we're talking about, who has currently paused its trials. It's supposed to be one of the most promising vaccine. Can you give us an insight into what's happening with vaccine in general across the globe and in the United States? And when can we sort of expect it, and who's going to get it first?
So there's more than half a dozen companies, vying to be the first solution to this pandemic. Let's be honest, the vaccine is going to be our best way out of this, but we have to understand that it has to be safe. There has to be enough of it. You can't create 200 to 300 million doses of the vaccine in a short period of time. It's going to take 6 months to a year, maybe longer, to create that many injections and then administer those to the public. Now, if they don't do it right, and if they try to rush through it, they're going to mess up the entire process of herd immunity, because then the public's not going to trust that the vaccine is safe. And that would be a disaster.
What kind of effectiveness are we looking for when we're looking at the vaccine? How effective does it need to be in order to be circulated around?
That's a really great question. Now, we can try to understand it, or maybe talk about it in terms of the flu vaccine, which everybody is familiar with. So everybody gets the flu vaccine. In typical years, the flu vaccine has, gives you somewhere between maybe 40 and 60% immunity, and that's a good year. Sometimes it's worse, sometimes it's better. And that's you have to multiply that across the entire population. So
Right.
in order to achieve herd immunity, which I'm sure a lot of folks have heard
Right.
that little soundbite, you have to have somewhere between 65 and 70% of the public
Yeah.
with antibodies or some sort of immune response, immune protection against the virus. So you'd have to vaccinate over 200 million people, probably close to 300 million people, in order to develop the types of herd immunity that we're looking for. We don't know what percent effectiveness the vaccine is going to give. So we're all anxiously awaiting some of the data that comes out of these trials.
For sure. So could we expect it by early 2021? What are your thoughts on it?
I think there's a good chance that we'll have something this fall.
Okay.
Whether or not it's something that's effective, or whether or not it's something that's safe, that's an entirely different question.
I wanted
But
to.
if sorry, go ahead.
No, go for it. Go for it.
Well, I was going to say it just depends on the science, right? I mean, if the scientists come back and they prove to us without a reasonable doubt that this thing works, it's safe, then I am happy to take my family down and get vaccinated. But in the absence of that, good hard data, I feel like the entire process at the moment is being rushed a bit.
And how much is the flu season that obviously is approaching, and we want to raise awareness about getting the flu shot? How much of that do you see impacting COVID-19 here?
We've had case reports of people actually being co-infected with both the flu and coronavirus.
Oh, wow.
So, and we also know that if you have co-infection, that those people actually get much sicker. So that's why for us as doctors, we want to try to get as many flu vaccines out there as possible. And we're encouraging people to come in now and get their flu vaccine. It takes typically 1 to 2 weeks to kick in. So that'll, you figure you get it now, it'll kick in about 2 weeks. And hopefully that'll give you some level of immunity for about 4, maybe 5 months.
Oh, wow. And do you recommend, especially that at high-risk patients, and we have a lot of them in the South Asian population, that they go ahead and get their flu shot?
Absolutely. Yeah. I mean, and now is the right time. Don't wait until somebody in your family gets sick or one of your friends gets sick. Just try to come in now. And that way it'll help us stop the spread of the flu virus. What we really, really need this year is a very mild flu season. And we can accomplish that if everybody goes out and gets the flu shot.
Yeah, so important. I want to continue discussing more on coronavirus. I want to sort of understand the movement of this virus, because right now, even though the cases are on a decline in the nation, and the death rates are somewhat, they're trying to balance it, they're trying to, deal with it. The areas such as Iowa, North Dakota, South Dakota, and areas around it is surging in cases. Can you explain what kind of pattern we are seeing? Why is it that we see a couple of states first get infected and then it goes to another region? Now we're looking at a third region. Why is that happening?
It's like a wildfire, right? And like these horrible wildfires we're seeing out in California and other parts of the country. Right. If there are a lot of trees in an area and it's been really dry, it's more likely to catch fire in those areas. And so I think what's happening is as people travel and they connect with other healthy people, infected people as they connect with congregate together with COVID patients, this virus is spreading. And what we know from the Princess Cruise Line study that came out a few months back was that maybe up to 80% of individuals may not show any symptoms. So up to 80% of people with COVID infection may not have any symptoms, and that's why I think it's important for you to go test if you have symptoms, and you should certainly self quarantine. But I think it makes sense to also test the people that are not having symptoms, because that'll also help us stop the spread of the virus.
Do you believe that we have enough testing in this nation? There has been a lot of reports recently where health experts have pushed for more testing, especially in the Midwest where the cases are surging. What's your comment on that?
I believe it depends on where you are. Like here in New Jersey, I think we're doing a great job of testing folks, and we are. I believe at the last I checked, much less than 10% of the people that we're testing are coming back with a positive result. So I think in New Jersey it's somewhere between 2 and 3% right now.
Oh, wow.
Which is not bad. But when that infection rate is higher than 10%, like in some southern states where they're testing and they're getting back 20% positivity rate on those, that means that these guys are not testing enough. I think it makes sense to do targeted testing. Yeah, sure. But I think also we need a larger rollout of testing in areas where we know the virus is spreading, like in a number of those states that you mentioned.
Right. And while all of this is happening, the nation continues to reopen. And the biggest thing are schools and universities. We're looking at all 50 states reporting positive cases in colleges. We're looking at schools still struggling with hybrid to in-person to online setting. My question to you is, since you are a doctor as well as a parent, how are you looking at this entire situation? And is it safe to send children back to school, or are there certain age groups we shouldn't send?
Yeah, that's a tough question. It's a good question, though. We struggle with that. As a father, I've got 2 little ones that are in elementary school, and so I was actually on the committee locally here that would work with the school district to help determine what that would look like. Do we open up the schools to a hybrid program? Do we do just all online? And I certainly gave my expertise, but eventually what we did was we allowed the parents the option to choose in our district. So if they felt like they could not send their child to school safely, there's children that have sort of compromised immune systems, or they have parents or grandparents at home that have compromised immune systems, and sending those kids out into school and bringing them back every day, I think would confer a pretty high risk to those families, and I think that would be a bad idea. So for us, my parents live with me, and they're getting older, so we made the decision as a family to keep the kids at home and not send them out. But it is a tough call, and I think parents have to do their own research. Here in New Jersey, the infection rates are low,
right,
but it's not zero, and people are still getting infected, and they're still getting very, very sick.
And then how are you looking at these situations in colleges and universities? We're talking about off-campus gatherings, Greek life congregating. We're talking about college parties that are still happening. How dangerous could this potentially be? And what's your advice to college students?
Yeah, read a lot of the reports, and a lot of colleges are cracking down pretty hard on students that are congregating in large numbers. My advice to college students is this is the next year of your life is not going to be normal, and you have an opportunity to just stay in your room or stay at home and focus focus on your studies. Don't do anything stupid that will get somebody else sick, maybe one of your family members sick or one of your friends sick. We really do need to pull together as a community and stop the spread of this coronavirus. I mean, I think it was just a few days ago I read about a young teacher in South Carolina that was 28 years old, and she died of COVID infection. And I keep hearing these stories from all over the nation. Young, healthy people that succumbed to COVID. So we owe our friends and family and our neighbors and our communities to be a little more disciplined about how we interact with each other and how we go about doing business in this world.
Yes. Key advice to college students, I hope they're listening. I think it's so important that we contain the spread of virus, especially in these settings. As a medical professional and as a person who is basically on the front line, what are currently your biggest worries or challenges that is facing the medical community?
Volume is one. I think we're at a point where the supply lines for PPE, for gloves and masks and stuff have finally started to become reestablished. So I'm not worried so much about running out of PPE, but I am worried about volume, that just the sheer numbers of patients that will be inundating us over the next few months. Going to the ERs, the urgent cares, the regular family practice doctors. It's just earlier this year, there were some days where I'd be seeing 40, 50, 60, 70 patients in a day. And it's just, it's emotionally and physically exhausting. And I'm definitely not looking forward to that in the months ahead.
Do you think we can avoid it? A second surge?
I don't see that happening. If the past month has been any sort of indication as to our discipline as a country, I don't think that we're going to avoid it. I think we're well into the second surge. Some places never really got out of the first surge, but for us here in the Northeast, there'll be a second surge.
Is there a way for us to protect ourselves?
I think there is. I think you could do what Dr. Fauci says and wear a mask, socially distance, and otherwise stay in good health. If you stay healthy, exercise, drink lots of water, I think that will go a very, very long way. Now, I get a lot of people asking about supplements and all those other things, and I don't know that really any supplements have shown or have proven to have had any sort of benefit in combating this infection or preventing you from getting it.
I have a couple of questions left here, so I want to quickly get through this. A report today came out which is saying that 40% of adults right now are skipping potentially life-saving medical care. They're not going to the hospitals, they're not going to clinics. What have you seen personally, and how important do you think it is for us to maintain the regular medical care for people that are at high risk or patients of other illnesses?
I think it's critical, and you bring up a really really great point. The other day, uh, actually just day before yesterday, I was seeing a patient in an urgent care. So I work in both the emergency room and the urgent cares in the area, and uh, this patient came, elderly gentleman, and he said, "I've been feeling palpitations in my chest for the past several days, and I'm afraid to go to the ER because I'm afraid that I will get, coronavirus." So we did a quick EKG on him and we checked him out, and he had actually a pretty dangerous heart arrhythmia. He was in rapid atrial fibrillation. So we ended up calling the ambulance and getting him transferred to the ER, where they could give him some definitive treatment for that. But I think so many of these types of cases are going on, these types of situations where people are afraid to go to the ER, and people are afraid to go to the ER and they're just waiting. So don't, if you have chest pain, if you're having trouble breathing, severe abdominal or belly pain, you're having palpitations, or you're having any stroke-like symptoms, don't wait, and that's not a call that you can take care of on telemedicine. You're going to need to see a doctor. They're going to need to do blood work. They're going to need to do some sort of testing to make sure that you're okay. So telemedicine definitely has its limits. I would urge people, if you're sick, go to the ER. Don't avoid them.
Yeah, don't be scared of it. They are taking all precautionary measures to keep that area safe. I'm sure you would agree to that.
Absolutely.
Yes, for sure. I have to ask you, since this has been in the news this entire week, the recording of President Trump that came out, this week, which said that he downplayed coronavirus in the beginning, or the administration downplayed coronavirus in the beginning. Do you think we as a nation acted too late in containing the spread of the virus? And is that the reason New York City, which was the epicenter, saw such a large amount of deaths and such a large amount of cases in the beginning?
Oh, absolutely. I don't think that there's any sort of doubt about that. Had we acted sooner, we could have saved tens of thousands of lives. And it is indefensible the way the administration has handled the coronavirus response. People have most certainly died that would not have died if we had handled this better.
Yes, Governor Murphy of New Jersey actually stated in an interview today that he also believes lives could have been saved had he known about it earlier. They would have shut down the state earlier. Do you agree with that?
Yeah, without a doubt. If you don't know that a pandemic virus is spreading, or something that has such high infectivity levels, how are you going to fight it? The government essentially, the current administration blinded us against one of our most dangerous enemies, and they did it willfully. And so I think, I believe in karma, and I think our current administration will have many, many lifetimes of bad karma to deal with for what they've done to this country and to the world.
What is needed in the healthcare system or public policy right now, according to you?
We need a cohesive response. I think it's wonderful that New Jersey and New York and some of the surrounding states here in the Northeast have banded together and said, okay, we're going to act as a group, and this is what we're going to do, and this is how we're going to defeat the coronavirus, and how we're going to help our public stay healthy. but we need that on a national level. We need a national cohesive strategy, and it's not hard to do. We have to mandate masks in public spaces. We have to make sure that people socially distance. We have to make sure that we change our behavior. So it can be done. Certainly in places all around the world, it's being done. New Zealand has done a phenomenal job at controlling their rates of infection. So I think there are models around the world that we can look at and then adopt as a part of a national cohesive strategy.
Right. Just a quick question here. Just looking at the world, India is surging in cases. Do you have any comments on what's happening with India or advice for people living there?
Yeah, I have friends and family that are there, and I sort of get feedback from them and their perspective. I feel, in my opinion, is that India is probably not testing enough, and they're probably underreporting the number of infections that are actually going on. Now, I think that time will tell, and we'll find out eventually how bad the infection rate is. But my advice to my friends and family and loved ones in India is to just quarantine as long as you can. And it's going to be a difficult time over this next year. Right. But just take every precaution necessary. This is not going to be going away anytime soon.
Lockdown restrictions have actually eased in India and parts of the world right now. Do you see that as a wise decision to make while they're surging with cases?
I don't think it's a wise decision. I think it's a business decision that's been made, to lift these restrictions. Many of our politicians care more about businesses than they do about public health. So they should meet with the families of people who have lost loved ones and try to explain to them why it's really, really important for people to go out and sit inside a restaurant, why that's more important than saving the life of their son or daughter. Yeah. So these are not public health decisions. These are business decisions that are being made, unfortunately.
Dr. Lieutenant Kamal Kalsi, it's always such an honor to have you here on ITV Gold with us. I would love for you to give one last message to our audience.
Wash your hands, wear your masks, and get tested. Even if you're not sick, even if you don't have symptoms, get tested.
Oh, wow. Well, thank you so much for your time.
Thank you. Take care.